Greetings, my beloved. My name is Faraja Oldenburg Mdegella, an internal medicine physician, currently working as a consultant at Rabbininsia Memorial Hospital, Dar es Salaam. I started my medical career at KCMC, the Kilimanjaro Christian Medical College in Moshi, where I did my MD and my internship. Then I started working as a registrar or a general practitioner at the Aga Khan hospitals in Dar es Salaam. I worked at the emergency department, the ICU and the outpatient emergency department. Then I moved to Muhimbili National Hospital, where I worked in the Jakaya Kikwete Heart Institute. I had worked as a general practitioner for 4 years, I believe, before I joined my master's. I did my MD in internal medicine at Bugando, Cuhas, Bugando. The reason why I chose Bugando was because I needed a different experience. I wanted to experience something else apart from what I already knew or I had already seen. That was the main reason why I chose Bugando. At that time, I did not know the college as much, but when I learned about their programs, I had learned about them from a friend, I wanted to experience it. And I would say I have no regrets. I am more thankful to have done that, although the reason was non-academical, but Cuhas Bugando has shaped me in ways that the other places didn't. Apart from consulting as a physician, I also do a lot of community education in terms of teaching the general community, but also providing education to their professionals, because throughout my career as a student and when I worked and even as a resident, and now that I am a specialist, I have learned that the reason why diseases either keep coming or they stay or we do not achieve the results we want when we treat our patients is because of the knowledge gap. There is a very big knowledge gap between the professionals and the community, but also there's a lot of misinformation about health in our society. So because I desire to see results, when I see my clients, I follow them closely because I desire to see results. I want to know what I am doing from my knowledge, from the books, from the research, if they're giving the same results. And because the lack of knowledge has been the main reason to why I have been failing, I decided that I was going to do something about it. And that's how I started all my social medias, the YouTube channel, and my writing career. Because currently I am also writing books about health. So it will be educating the community about health, or something that would help my patients comply to their treatment, or it will be something that would help the health professionals, especially the junior health professionals, comply to the principles of medicine and treatment. So I write books, of course I teach through social media and media platforms, but I also do health education and preventive medicine to companies, to churches, to schools. So I would give them health talks, we will do some activities about health, and sometimes we provide initial tests and initial management or guidance. So the one thing that would make me remember Cuhas Bugando and my experiences at Cuhas Bugando in my day-to-day life is the fact that always before I say anything or before I teach or even before I treat my patients, I always ask myself, what evidence do I have? This is something that Cuhas Bugando impacted in me, in my life and in my daily career. Bugando is very big in research. Every time I tried to do something when I was in Bugando, I always had to provide evidence. And that was the most difficult part with me, because sometimes I would know something and I wouldn't know where it came from. So I had to learn to know whatever I know, where did it come from, what is the evidence behind it, and how can I back it up. That, I would say, thanks to Bugando. That is one thing that makes me remember Bugando, and I practice that every day. Another thing that made Bugando stand out for me in my career is the quality and the character of our teachers. See, our teachers in Bugando, they were kind, and you would think they were friendly. I'm not sure if they were, but they were very strict when it came to education and knowledge impaction. The environment was friendly and unfriendly at the same time, and that kept us on our toes. It did help me learn, but also learn how to be serious. And that, I must say, is something that I really took that with me, and I am living it every day. I do not want to be too friendly that I fail to deliver, especially in the medical field. And I prefer to be labeled as strict, because then it helps me, my juniors, the ones that are working under me, and all the other health professionals, to be serious about our patients. There has been a gap in the medical field where teachers and students become too friendly or too strict, and then the learning is not balanced. But that was not there in Bugando. In Bugando, you will be close to your teachers and they will be friendly, but you know there is a limit, and you know that there is that strictness that needs to be maintained. That is something that helps students to learn and to get serious. Too friendly to juniors is not a very good thing. Too strict is also not a good thing. So that balance is something that I learned in Bugando. I experienced it, I liked it, and I took it. And I am practicing it every day. And it is one of the reasons I would recommend anyone to go to Bugando, especially for masters, because I did my masters at Bugando. So that is one of the reasons I would recommend someone to go to Bugando, to learn a character, because being a medical professional, being a doctor, is more of a character issue and being safe than it is of knowing too much. So for those who really want to be good doctors, they really want to build a good character, going through this kind of experience builds a character. And for that, I am thankful to Cuhas Bugando. I hope this inspires someone.